Hi everybody, sorry that I'm making this fairly regular. Today my topic was decorticate versus decerebrate positioning, and so both of these are referred to as abnormal posturing, and they're an involuntary response indicating severe brain injury. So they're involuntary flexion or extension of the arms and legs, and what happens is that one set of muscles ceases to function and the other is stimulated by an external source such as pain, which causes the contraction. So the posturing may also occur without a stimulus, but it just depends on the injury. Since posturing is an important indicator of the amount of damage that's occurred to the brain, it's used by medical professionals to measure the severity of a coma, and that can either be measured, as we know, with the Glasgow Coma Scale for adults or the pediatric Glasgow Coma Scale for infants. Both decerebrate and decorticate posturing are strongly associated with poor outcome in a variety of conditions. The changes in the condition of the patient may cause him or her to alternate between the decorticate or decerebrate. And it's caused by large increases in intracranial pressure, which can be traumatic brain injury, stroke, intracranial hemorrhage, brain tumors, encephalopathy, Creutzfeldt-Jakob disease, which if you've seen, like when you go to give blood or something, you have to check a little box about that. That's the original mad cow disease that you can now get, but the onset's just 65 and it's not contagious. You can also get it from diffuse cerebral hypoxia and brain abscesses. Posturing due to a stroke usually only occurs on one side of the body and may also be referred to as spastic hemiplegia. Diseases such as malaria have also been known to cause the brain to swell, and same as any other swelling of the brain, they can cause the posturing effect. Decerebrate and decorticate posturing can indicate that brain herniation is occurring or it's about to occur, so it's really important for us to keep an eye on that. And in herniation syndrome, this occurs, which is indicative, obviously, of brain herniation. The condition, if left untreated, can worsen from decorticate into decerebrate. Types of abnormal posturing, like I said, decorticate or decerebrate, and the names depend on different characteristics. So I'll start with decorticate posturing, and it's also called decorticate response, decorticate rigidity, flexor posturing, or it can be called mummy baby, which is not politically correct or professional in any way. So patients who have this present with their arms flexed or bent inward on the chest, the hands are clenched into fists, and the legs are extended with the feet turned inward. So that is shown in this person right here. A person displaying decorticate posturing in response to pain gets a score of 3 on the motor section of the Glasgow Coma Scale. And there's 2 different parts of decorticate posturing. This is very in-depth, just so you know, warning. The first is disinhibition of the red nucleus with facilitation of the rubrospinal tract. The rubrospinal tract, as we may or may not remember, facilitates motor neurons in the cervical spinal cord, which supply the flexor muscles of the upper extremities. The rubrospinal tract and medullary reticulospinal tract bias the flexion, and that makes the flexion outweigh the extension in the upper extremities, which results in flexed upper extremities, obviously. And then the second component is the disruption of the lateral corticospinal tract, and that facilitates motor neurons in the lower spinal cord, which supply flexor muscles. So because that's disrupted, the extensor muscles are now going to overpower, so the lower extremity they will be extended. So the effects on these 2 tracts, by the corticospinal and rubrospinal tracts, by lesions above the red nucleus, is what leads to the characteristic flexion posturing of the upper extremities and extensor posturing of the lower extremities. Decorticate posturing indicates that there may be damage to areas including the cerebral hemispheres, the internal capsule, and the thalamus. It may also indicate damage to the midbrain. While decorticate posturing is still a bad sign of brain damage, decerebrate posturing is usually indicative of more severe damage, as the rubrospinal tract and the red nucleus are also involved lower in the brain stem. So I'm going to stop this and give you guys one more video on decerebrate posturing.